It's a great achievement on the part of the governor. Some of us who know him, who have been associated with him, know that he's capable of doing something good. It's part of what he's doing. And I know that before he completes his second tenure, he would have demonstrated his innate ability, his desire to transform this state. So this is just the beginning. I believe very much in him and what he's capable of doing. So it's a great congratulations to him.
Mobile hospital. It's a hospital that has all the facilities that you can get in a standard hospital. We went there now. There's an eye surgery that is going on there, with operation for cataract. Because the hospital can, apart from ordinary treatment, they can also perform surgery. Any type of surgery can be performed in that environment. If you notice, most of the operations that will be done, they are what we call day cases. That is, they operated and they go home that same day, which is not the international standard. I think they will be here for about a week. This program will be here for about a week. Now, if it requires treatment beyond a week, there are designated hospitals where they will attend. Even teaching hospitals, if it's a very serious case that they cannot manage here, because obviously this kind of setting cannot manage all the cases that you have.
You need to see the surgeries we're doing in the rural health scheme. You will marvel. At a time, in the first 1 year, the first 2 years, it was a harvest of operation. In one of such cases, we removed a fibroid weighing 10.5 or 10.8 kilogram. That was the biggest fibroid ever removed that most gynecologists in this area have ever seen.
I born this child. As he dey 1 year, I come dey check am, him belle come dey big small. So as he dey big, me myself dey carry am dey waka up and down. So as I dey carry am dey waka, so before dem come call us say all this free doctor come, I come carry am come there. So dem come do am. But I thank God today, say the boy, if you see him, you no go know him again. Now I'm very, very happy.
There were many people in the past 5 years who have lost their sight, for onward of 15 years, who have been hopeless, thinking that they will never see in their life again, that, just removal of their cataracts on both eyes bilaterally have regained their sight. And so, on a yearly basis, we see about 20,000, approximately 20,000 of such patients across the state. And so it's been very rewarding. The patients are very grateful. Deltans are very grateful in these 3 programs that the Delta state government has made free to them.
In the course of this free rural eye care, this girl was seen in our theater, having been screened outside for having congenital cataract. We took her to the theater and yesterday and this morning we opened her eyes. Open her eye. She can walk around on her own now. We are taking her in today for the second eye to remove the cataract.
As you people dey here now, I just hear say people dey, but I'm not recognizing her face. Even when people that pass that, they just see them. But for now, I do see all her face clearly now. I'm very, very happy for Uduaghan because of these great things.
And the eyes have been operated yesterday, and they have told us to come back to clean up our operated eyes today. That's how we come back, and everything have checked up and doing well with us. I paid nothing. It's free to us.
my suffering and smiling. Finger of God upon us, we're shining. Governor Lodwagos walking, we're happy. Happily with Deltas, they merry. Deltas, they no more suffering and smiling. Finger of God upon us, we're shining. Governor Lodwagos walking, we're happy. Happily with Deltas, they merry. Social amenities day. Good security day. Good water they flow. Do I go, make it a go. We enjoy you, Baba, make it a go.
Rural Health Scheme is a program that have increased the sight of people, a program that have removed disease burden, that have removed even mortality burden, death burden from the citizenry of Delta State. And so a healthy Delta will be able to fend well for themselves and add value to the human capital development of the citizenry of Delta State. We have a teaching hospital now that is doing very well, one of the best in sub-Saharan Africa.
A state-owned teaching hospital at Orange is a shining example of how a state can bring modern medical facilities to its citizens.
Dr. Emmanuel Udua ensured that all the buildings were completed, fully equipped, and started, took off by way of commissioning. And since then, I'm sure many hospitals in the nation now, even in they're making referral to that hospital because of the state-of-the-art equipment.
The hospital has facilities that could compare with similar hospitals in Europe and America. Take a trip with me and see. This is the hospital we call a Kendosa. It boasts of a critical care, accident and emergency department with its own dedicated operating theater and imaging support, computerized tomography, CT, magnetic resonance imaging, MRI, 4D ultrasound, complete rigid and flexible digital endoscopy equipment, ultra-modern operating theaters and equipment, patient archiving and communication systems, radiology information system, RIS, healthcare informatics service with online ICD-9 support.
And we are proud to mention that very soon we'll start our own kidney transplant. We're already doing total hip replacement surgery, total knee replacement surgery that has never been done in any teaching hospital. We were the first teaching hospital to do that.
Joint replacement, hip joint replacement, knee joint replacement, minimally invasive surgery, developing a dialysis service. Those are specialties which we have done. Delta State government has subsidized it in a number of ways. First of all, virtually all the equipment is provided by Delta State government. And of course, you can hardly pay for the price of using all that equipment. All the staff is paid by Delta State government. So if you are running a business where you have to take all of this into consideration, then it will be impossible for people to use. So basically, the fees are comparable with that in any teaching hospital in Nigeria.
But more particular, as regards the teaching hospital, we've been able to bring also Deltans who are in diaspora, or even Nigerians who are in diaspora, who have been working in Europe and America, who has gotten the experience, expertise to use the sophisticated medical equipment that we have in the teaching hospital.
From providing free and qualitative health care to pregnant women and children under 5, to H0 Health Scheme, which has benefited hundreds of thousands of Deltas, the Udonian administration is in the forefront of ending health tourism to India and other Western countries.
Today, Delta State can boast and can parade the largest number of hospital facilities in the country. Today, in Delta State, we have over 450 functional healthcare centers. Many of them were built and equipped by the government of Dr. Emmanuel Eweta Oduah. In our government hospital, if you are an adult, you have diabetes, you have hypertension, you are going to see the doctor, it's still 10 naira per card. I'm sure that is the only, in Delta, 10 naira.
That's all you pay.
That's all you pay. Overall goal is to ensure that diseases, that is, and sicknesses and death is drastically reduced to the barest minimum in Delta State.
The government which takes the health care of citizens seriously will expect a healthier workforce.
Yes! Yeah, yeah! Oh, Delta is working. The people are smiling. The finger of God is working. Yeah, the people are smiling. Yeah, yeah, yeah. Affordable education, good road and transportation, power supply, health service like never before. It's all wado. Urobo wado. Ishekiri wado. Igbo wado. Delta State, no more suffering and smiling. Finger of God upon us we're shining. Governor Oduah goes working, we're happy. Happily with Delta's the merry. Delta State, no more suffering and smiling. Finger of God upon us we're shining. Governor Oduah goes working, we're happy. Happily with